Hi, my name is Dr. Paul Questenberry, and I'm a family physician in Chambersburg, Pennsylvania. You're probably watching this because you're either really bored and searching the web, or I've seen you in the office and diagnosed you with shingles. I want to teach you a little bit about shingles and how you can manage, and I would also like to address some of the questions that frequently come up during the course of treatment. Firstly, a little bit about shingles. Shingles will affect at least 1/3 of Americans sometime in their life. So that's a lot of people getting shingles. In fact, about 1 million people get diagnosed with shingles each year. Your risk of getting shingles goes up significantly after age 50. A lot of the people who have a really difficult time with shingles are older folks, and the incidence rises with each year that you get older, and the severity of the disease tends to be more severe in older people. So I'd like to answer a couple of questions that frequently come up about shingles. Firstly, what is it that causes shingles? And that's an interesting question that sometimes is difficult for people to understand. So the virus that causes shingles is called the varicella-zoster virus. The varicella part of it is the childhood part of it, and the zoster part of it is the adult kind. So what you can think about shingles is that it is a virus that causes two different diseases. The chickenpox, the varicella, tends to affect children. The shingles, or the zoster, tends to affect adults. And you have to have chickenpox before you can have shingles, and that's a really important thing to understand. So remember, there's two different syndromes that are associated with the varicella-zoster virus. So how would you know if you have shingles? Well, there's a lot of misinformation out there, but there's two typical parts of the disease. The first part is the pain, and the second part is the rash. So there is a prodrome that typically precedes shingles. For about 75% of individuals, they have some burning, tingling, or some odd sensations in an area around their body. About 75% of people get that prodrome, and that is always on one side of the body. So in other words, if you have shingles, or if you have symptoms on both sides of your body, you do not have shingles by definition. In fact, the word shingles comes from a word which means belt. So it appears in a belt-like area around the body, but it regards the midline. It does not pass the midline. So how do you know if you have shingles? The prodrome typically appears first, and that can precede the rash by days, but it can sometimes precede the rash by weeks. The rash appears very characteristic. In fact, when you went to see the doctor, they probably just stared at it and said, "You have shingles." It's very, very characteristic. It looks like little blisters, and they form in clusters, and then they kind of they open up and drain, and they form ulcers. These ulcers get crusty, and they heal over the course of 7 to 10 days, and in fact they're no longer considered infectious after days 7 to 10. These typically take 3 to 4 weeks to heal up more completely, but I have seen people who have scars from shingles that last forever. So what are the other symptoms that accompany shingles? As mentioned, there are two parts. There's the rash, and then there's the neuritis. Neuritis is the fancy word for inflammation of a nerve. I always tell people that us doctors have $10 word for 5-cent ideas. The idea is that there's inflammation of a nerve. So what happens is this: the chickenpox virus gets on your skin, and it gets back into the nerves that send feeling to a band of your body, and they stay there for years and years. So you had chickenpox when you were 3 or 4 or 5, and the virus has stayed in your system, and for some reason it has decided to come out and cause the current problem. Now, everybody will blame it on stress or other things, but we do not understand why some people have outbreaks of shingles. Anyway, two parts of this, the rash and the neuritis. The rash, as described previously, the neuritis is inflammation of the nerves. Now, the pain from shingles is very different than the pain from other disease processes. When somebody hits you in a muscle, you get inflammation and redness and soreness, and Ice and anti-inflammatory medicine can be helpful, but the pain from shingles is very different than the pain from most muscular kind of injuries. It's described as a burning, tingling kind of pain, and many people describe it as being very sharp, like being stabbed. You can even get to the point where your skin feels like it's very sensitive to touch, and anything, even clothing, can cause some severe pain. So the pain is very different. So once again, two parts of the disease, the rash and the inflammation of the nerves. And there are a number of things that can come out of the neuritis, and we'll talk about those in a minute. So how do we treat shingles? Well, once again, there's two parts to this process. First is treatment of the virus, and then there's treatment for the pain that goes along with it. There are a number of antiviral medicines that we use for shingles. Probably the two most utilized are valacyclovir, or the trade name is Valtrex, famciclovir, or the trade name is Famvir. People also use acyclovir, but is not quite as effective or easy to use as the other two. So most people use Famvir and Valtrex. These medicines are typically given for a week, and they help to cut down on the growth of the virus. So that's how we treat it. A lot of people don't recommend treatment with antiviral medicines like Famvir or Valtrex after age 50, or if you have very mild symptoms. So it's very appropriate not to use those antiviral medicines if you're having mild symptoms or you're under the age of 50. Let's talk a little bit about pain medicine. This is a really complicated part of this, and there's a lot of controversy out there about treatment for what works and what doesn't work. For many individuals, along with the virus, I typically give them at least one or two other medicines depending on the severity of the pain. For many individuals, we use prednisone for several weeks. There's some controversy about that, but some people find it very effective for relieving the pain associated with shingles. Many people end up on medicines called tricyclic antidepressants. You would say, why would we use a depression medicine for shingles? Well, interestingly enough, some of the antidepressant medicines like amitriptyline and nortriptyline modulate chronic pain, and frequently shingles ends up being a chronically painful condition, and that's why we use them. Amitriptyline is probably the one that's most studied for this purpose, but nortriptyline gets a lot of use as well because it tends to be tolerated much better. I frequently start people with 10 or 20 milligrams of nortriptyline and go up to 25 to 50 milligrams depending on whether they need more pain relief. There's a medicine called gabapentin, or the trade name is Neurontin, or the other one is Lyrica. These are anti-seizure medicines, and once again you would say, why are you giving me seizure medicines for the shingles? Once again, they tend to be really good for chronic pain. So if I've given you gabapentin, I typically have people start with one of the 300 milligram pills at night, and gradually increasing it to 2 or even 3 of those at night. Now, the tricyclic antidepressants and the gabapentin act very differently than other pain medicines. They're not like Advil or Aleve that you take it and you get some relief. These two families of medicines tend to take a little while to begin to work, and the reality is we don't actually know how they work. But for the gabapentin, I typically start at 1 and go up until people are getting some relief. Now, these medicines can be associated with some nausea, some sedation, and some dizziness, but they really are good for the pain that accompanies shingles. Another thing I typically give people when they get shingles is a lidoderm patch. And lidoderm is a numbing medicine. And if you're looking at the back of me and the nerves that come out, if the shingles rash is going around like this, you put the patch on the back where the nerve comes out, and you put it right over that area, and it numbs the nerve, so it can really give people meaningful pain relief. So it's a patch that you put on your skin. Now, you can only wear it for about 12 hours a day, and usually people wear it in the evening and at night so they can sleep. You can certainly use anti-inflammatory medicines like Advil or Aleve in addition to these other pain medications, but once again, they tend not to be as effective as the ones I've mentioned previously. Oftentimes I give people something a little stronger for pain, something that has codeine like Percocet or Vicodin, and that can be helpful in addition to the above. One of the common questions that people ask me about shingles is, am I contagious? And it's a difficult question because remember I told you that there's a grown-up and there's an adult form of shingles. The childhood version is called chickenpox. The adult version is called zoster. You actually have to have chickenpox before you can have zoster. So the reality of it is that you didn't get the shingles from someone else. You got them from yourself. Okay? That's really weird, I know. It sounds like something from a horror movie, but the virus has been laying inside of you all of these years, and for whatever reason it's decided to come back out. So are you contagious? Typically you are contagious to people who have not had chickenpox or had the vaccine. Now, most children are being vaccinated against chickenpox now, so the likelihood that you're going to share this with a child is pretty low. We vaccinate children with their first chickenpox vaccine around age 1, so the problem could be in children under the age of 1, so you could be contagious to them. One of the things that we recommend is that you keep the wounds covered until they heal over really well. One of the other things that people say to me a lot is, well, I don't know if I've had chickenpox. There are really good studies that say that about 95% of American adults have had chickenpox. So even if you don't remember, there's a 95% chance that you have already had the chickenpox, so you don't need to worry about this problem. You don't need to worry about getting chickenpox from somebody who has the shingles. People also ask me about that for purposes of the vaccine, but you don't need the vaccine because there's a 95% chance that you are immune to chickenpox. So how long does it take for treatment to work? Usually people start feeling better after they see us, but sometimes the pain can last weeks to months after being diagnosed with shingles. And this is a really frustrating illness. I oftentimes tell people that this is not a battle, it's more of a siege. It takes a long time to get rid of these. But usually within a couple of days people start feeling a little bit better. So what are the complications of shingles? Well, there's a number of them. One of the more immediate complications is the fact that shingles can happen in the eye, can involve the eye. Typically you know that if the rash is around the eye, particularly on the cheek or on the tip of the nose. So if you have shingles and it involves that area, you're going to want to see an eye doctor. And this is really serious stuff. Even if you don't have the shingles very bad, the involvement of the eye is very concerning. So if you have any redness or irritation of the eye, or the rash involves the tip side of the nose, you should see an eye doctor. So eye complications are a big problem with shingles. One of the other immediate complications is that shingles can oftentimes get infected and you'll begin to notice a yucky kind of drainage from it. The other thing is honey-colored crusts, or what we call impetigo. That happens with shingles. If those happen, you can oftentimes use something topical like a triple antibiotic ointment, or you can end up on oral antibiotics, but that you would have to get in contact with your physician about. Occasionally the virus that causes shingles gets into your system and causes more serious problems and fevers and lung infections, but that's very unusual, so that's not usually an issue unless you're older or you have some compromise of your immune system. One of the more common, maybe dreaded complications of shingles is post-herpetic neuralgia. Post-herpetic neuralgia affects about 10 to 15% of individuals who get shingles, and it's pain in the area where the rash occurred that lasts more than 4 months after the initial diagnosis. And this is a real problem, and it's something that you'll need to connect with your doctor about because it can be difficult to treat. It's frequently treated with the gabapentin and the nortriptyline, as mentioned previously. So what about prevention? There's a vaccine that's advertising the heck out of everybody on television from the company who makes it. It's called the Zoster vaccine. It's a good vaccine. It's recommended after age 60, and it's about 50 to 70% effective for preventing the shingles. So people ask me if they should get it, and I say, well, it depends on whether or not you're going to get shingles in the next year. But do I recommend it for people? I absolutely do. Because shingles is a miserable illness, and it can be prevented 50 to 70% of the time. We're vaccinating children for for chickenpox, so certainly that should be a preventive measure for shingles as well. If you have other questions, please put them below, and I will try to respond. Otherwise, thank you for listening.